Welcome back. My name is Dr. Sheik and I'm a licensed clinical psychologist. And today we're going to have a conversation in honor of Suicide Prevention Awareness Month. So if you recall, probably almost a year ago, I did a video on suicide prevention. So if you want to watch a video on additional information, like I give some stats, some other data points in that video, some misconceptions of suicide, I'll place a link to that video here so you can take a look at it. I must admit, I was a little bit robotic in that video, but it's some information in it, so feel free to go and take a look at it if you wanted some additional information. But let's start by talking about suicidal thoughts or ideations as well as suicidal behaviors. Now, what do we mean when we say suicidal ideations and suicidal thoughts? Suicidal thoughts tend to be passive or active. Now, when we say passive thoughts, we're talking about those thoughts such as, I wish I was no longer here anymore. I wish I could go to sleep and not wake up again. I wish I could not be here so this pain wouldn't be here. If I were to have an accident and were to die, I'd be okay with that. Those are more passive thoughts, and we consider them passive because it's not you actively thinking about ways to hurt or harm yourself. So there is no intent or planning behind those suicidal thoughts. Now, when we talk about active suicidal thoughts, we're talking about actually thinking of plans of how you would want to hurt or harm yourself. These are the more intent or planful type thoughts when it comes to suicidal ideation or suicidal thoughts. These are the thoughts that says, this is what I plan to do, this is how I plan to do it, this is when I plan to do it. It's having a plan or an idea of what you want to do in order to end your life. So these are more active suicidal ideations or thoughts. So when we talk about suicidal behaviors can be preparatory behavior. So when we talk about preparatory behaviors, we're talking about writing a letter to loved ones. It could be you creating a final video to everyone. It could be you getting your finances in order so your family is taken care of. It could be you giving away your valuables. It could be you purchasing a firearm or collecting medications or looking up ways to engage in suicidal behaviors. Those are all preparatory behaviors. Also, self-harm is a suicidal behavior. Now, if you want some additional information about self-harm, I also did a video on self-harm that talks about a lot of information about self-harm. So if you want some additional information about self-harm, take a look at this video right here. Along with preparatory behaviors and self-harm, there's also suicide attempts. Now, suicide attempts is any act that you've engaged in or any behavior that you've engaged in order to end your life. So this is what we consider a suicide attempt. So those are suicidal ideations and those are suicidal behaviors. What are some of the risk factors for suicidality? Risk factors can be financial distress. It could be the loss of a job or a loss of a loved one or the loss of a relationship. It can be stressors such as relationship stress, job stress. It can be the stress of being a parent. Also could be different mental health concerns. So experiencing elevated depression or elevated anxiety or a history of trauma or a history of negative life experiences or a series of negative life experiences happening currently. It could be a whole host of things. And one of the things that it also can be is the inability to effectively problem solve. And when we have an inability to effectively problem solve, we tend to have multiple life stressors happening at once that we feel like we can't handle because we aren't able to think of adequate solutions. So all those are risk factors for suicidality. Now, what are some of the protective factors? Protective factors can be your own resilience. Like, how resilient are you with dealing with different life stressors? Another one could be effective coping strategies. What strategies do you have now to handle life stressors? What strategies do you have to deal with different emotional distress? Additionally, protective factors are having a supportive network around you of family members and friends or people you can talk to or people you can confide in when you're dealing with a lot of life stressors. Being willing to reach out for help, being willing to follow a plan to maintain your safety. Also having financial stability, having to take care of children, having to be a parent. All of these are protective factors against suicidality. And with risk factors and protective factors, we also have to think about, are there ways to prevent suicidal behaviors? Now, we can't necessarily prevent suicidal thoughts because our thoughts are what they are. We may have ways of minimizing those thoughts when we are confronted with multiple life stressors or an overwhelming life stressor, but we may not have the ability to completely prevent the thoughts from happening. But we do have the ability to prevent the engagement in suicidal behaviors. So what does prevention look like? Number one, with the prevention prevention is being aware. Without awareness, we can't actually acknowledge what needs to be changed, and we can't actually know what's happening inside of us. So when I talk about awareness, I mean awareness of your own suicidal triggers. So what are the things that let you know that you are in crises? What are those things that happen within you? What are those things that happen around you that let you know that you are in crises? And when I say that, what I mean is, do you start to isolate more? Are you less interactive with people around you? Do you find that you're drinking or using drugs more? Do you find that you're self-medicating, is what we call that? So do you find that your anxiety elevates, or you feel a level of sadness or anger that is outside of like your normal levels of sadness or anger? Do you start to eat less? Do you start to eat more? What are those signs that let you know that you are in crises? Are you starting to research ways of hurting yourself? Are you starting to have those suicidal thoughts more frequently? Know for yourself what that looks like. And one of the primary ways that we in mental health tend to help is by having a plan. And we normally do this in the form of a safety plan. And you can find probably some guides online to create a safety plan. And it's not just a piece of paper. What we understand is that when you are in crises, that means most of the time you feel like you're constantly in a hyper arousal state, and you are constantly in what feels like fight or flight or freeze. And your emotions are so overwhelming that the ability for you to think clearly is not always present. So what this plan does, which happens to be on a piece of paper, what it does is give you a plan of action to de-escalate. Because the goal is to learn how to de-escalate when these emotions feel overwhelming, when these thoughts feel overwhelming, when you are engaging in behaviors that let you know you're in crises. The goal is to have a plan for what do I need to do to de-escalate these emotions, and also maybe to get out of the environment that I'm in right now that may be causing me to feel more overwhelmed by life circumstances. So it also outlines the individuals that you feel comfortable reaching out to, the individuals you feel like talking to. You don't necessarily let them know you're in crisis or that you need some level of assistance, but they're just people you talk to because you like talking to them. But then there's also individuals you talk to that you let know you're in crises because you know they have the bandwidth to handle the fact that you're in crises, and they know and they have a plan to deal with what's going to happen should you be in crises moving forward. Along with having friends and family members to contact, the safety plan also outlines like who are the mental health and medical professionals that you can reach out to. So I hope that everyone is aware of 988, which is the crisis line, which you can call when you're feeling overwhelmed and when you're feeling suicidal. Also, some of us have mental health providers that we can contact when we're feeling overwhelmed, or we have like an already built-in network of medical providers that we feel comfortable with, just to let them know that you're feeling like some level of crises and that you need some assistance. And if you weren't aware of this, you can report to any emergency department if you're having a mental health crisis, because 9 times out of 10, they will have a psychiatrist on staff in that emergency department, and they will have either a psychologist or a social worker on staff to deal with that mental health crisis. Now, could reporting to the emergency department lead to you being hospitalized? Yes. There is no guarantee that you will not be hospitalized. But even in the case that you have to be hospitalized, the goal in that moment is to get you stabilized so you're able to handle life stressors. Not everyone who goes to the emergency department for a mental health crisis is hospitalized. That is something that they will assess, and that is something that they will talk to you about if you do go to the emergency department. You can also go to some urgent cares. I'm not as familiar with that process, but I imagine they do have mental health providers on staff there at our urgent care facility as well. So these are prevention strategies. Prevention is number 1, being aware. Number 2, having a plan. And number 3, knowing when to implement that plan. And we implement that plan when we start to feel those signs that let us know that we're in crises. So what I hope you take from today's conversation is that there are suicidal ideations. There are also suicidal behaviors. There are risk factors that can increase the likelihood of you engaging in suicidal behaviors, and there are protective factors that decrease the likelihood of you engaging in suicidal behaviors. And there are also prevention strategies that are helpful for you to be able to manage our possible life crises or suicidal crises. Being aware, having a plan, and knowing when to implement that plan is the most helpful strategy for being able to prevent the likelihood of engaging in suicidal behaviors. As always, if you have any questions or concerns, please feel free to jot jot them down below. I hope you learned something from this video today. I thank you for taking time to listen, and I'll be seeing you again very soon. Thank you.